Skeleton's something more than just a creepy thing we see at Halloween. It's made of two regions, the axial skeleton, which is the skull, the vertebral column, and the thoracic cage, we often call the ribs. The second part's the appendicular, and the appendages refer to arms, legs, and where they attach, such as the pelvic girdle and the pectoral girdle, the shoulder area. The axial skeleton, which is going to be the emphasis of this lecture, has the skull as its centerpiece because there's a lot of bones in the skull, and we're going to go through them slowly. The cranial bones, or cranium, this is going to support and protect the brain, and it provides a lot of attachment sites for muscles of the neck and the head. The facial bones, there are cavities for all sorts of sense organs and sinuses for passage of air. Of course, it holds the teeth and also anchors the many muscles of the face. Let's look at the major cranial bones here, color version. There's 8. I don't care that you know that number, but I do want you to recognize that there's a paired parietal and there's a temporal on both sides, so that kind of helps. A pair of parietals and a pair of temporal. Then there's a frontal. There's a sphenoid, which I'll be going through, and the ethmoid. And finally in the back, the occipital. As I promised, we're going to go through this slowly. So we'll start with the temporal bone. Think of the temples on the skull. On the posterior or back part of the temporal bone is what's called the mastoid. And it's an air-filled compartment. In some cases, if someone has a bad ear infection, that mastoid's going to become infected as fluids back up into that chamber. The cheekbones, think of Hollywood movie stars with that prominent zygomatic process. It's a major part of the cheekbone. That's where muscles attach. Continuing with the temporal bone, the styloid process, which you don't see, it's below the mastoid, and this is where some of the neck and tongue muscles attach. And this is why when you're getting a massage, you don't want an amateur doing it, because if they dig their thumbs in deep enough, they can snap that slender styloid process right off. Auditory meatus is just a canal, and on a skull you see a hole, and that's going to direct sound waves into the middle and inner ear. Carrying on, the middle of the base of the skull, which is where a lot of the bones are held together. Hang on a sec. Is the sphenoid. Sorry. And it's really neat because if you look at the bones of the skull, there's a frontal, there's an occipital, there's a parietal, and they're all kind of held together by that sphenoid. The body of the sphenoid contains a lot of sinuses that are going to drain into the nasal cavity. The wings, there's the greater and lesser wings that you don't need to know. They're part of the floor of the cranium, and they also form the front part of the orbits of the eye. Continuing with the sphenoid, as I said, we're going to go slowly through this, is the sella turcica, and that's the turkey saddle. It is kind of saddle-shaped because it protects the precious pituitary gland at the base of the brain, and this gland controls so much, our body temperature, metabolic rate, and so the body in its wisdom has protected it with that sella turcica. The foramen ovale, anytime you see the word foramen, that's a Latin word for hole. And when you see a hole in bone, generally it's a passageway, either for nerves, which is the ovale, or the foramen spinosum. That's a large opening for blood vessels, so that the blood has an ample blood supply. Ethmoid is towards the front or anterior part of the skull, and it's the bone that supports the nasal cavity. It's superior. Superior means above. It's above the eyes. It's anterior, which means it's the front part of the cranium. And it's medial, which means it's in the middle. So right at the sort of the bridge of your nose, a little above the bridge of the nose, is this ethmoid bone. It has a cribriform plate, which is full of holes, so that when we smell something, the little particles are going to float into your nose, and they're going to attach to the base of the cribriform plate, and there's receptors waiting there. And so we know, hey, this smells good, or this is, wow, this is lousy. Crista galli is just a ridge because the brain, we don't want the brain moving around a lot. And so the crista galli is a attachment. It's a ridge where many of the membranes attach and help to secure the brain. Frontal bone. Generally men, we have large frontal bones because historically we would beat each other with clubs, whereas women tended not to engage in these activities. So the woman's skull has a smaller frontal bone. It doesn't have that large ridge. Okay, it's superior part of the orbits, so the right above the eyes. The frontal sinus is deep or below the frontal bone, just above the supraorbital margin, and that's that bony ridge I was talking about that guys have. These frontal sinuses often get infected, especially when the flow of mucus is interrupted. And so it's important for, if you start getting stuffed up, you got to reestablish that mucus flow. Lots of fluids, sometimes steroidal inhalants, steam, breathing steam, anything to moisten that dried out mucus plug that is preventing the frontal sinuses from draining. Occipital, think of back, occipit. The occipital bone is where the foramen magnum is, and that's the large hole where our spinal cord attaches. And you'll see it, you can see it here. And the external occipital protuberance, which is kind of cool because you can actually feel it if you take your hand and rub the back of your skull. That's a ridge where many ligaments are going to extend to the cervical vertebra. Those are the bony vertebra of the neck, and also support the head and neck. So even though it's a small protuberance, in fact, in some people it's fairly large, especially some of the guys. But it's neat that you can feel it. Fontanelles, these tend to be the joints between infant cranial bones, and they're going to gradually ossify. That word ossify means they're going to become bony. And these are important because women, when they pass that skull out of the birth canal, they benefit from the fontanelles. It's going to allow the plates of the skull to sort of pass each other, and so the brain, the cranium gets is smaller. And sometimes when the child is born, you can see the pulse right through the top of the skull, because the fontanelles, even though they're soft, they're fairly tough, surprisingly tough. You can tell the age of a child often by the anterior fontanelle. It's large, and it becomes ossified by 2 years of age. But even as someone who's a 12-year-old, still that anterior frontal bone is going to be fairly large. Sutures are joints between bones. We don't think of these as joints. The plates of the skull. Sometimes people see a skull and they think they're just cracks. No, they're not cracks. Those are formally articulated or movable joints, as I said, when the child is born. The coronal suture unites the frontal bone with the two parietal bones. And coronal means crown, and so it kind of goes over the head like a crown. The squamosal is going to unite the parietal and the temporal bones. So think of the temples, and think of the parietals being the two that meet in the middle. Sagittal unites the two parietal bones. And if you see a gorilla skull or a primitive skull, sometimes you see a ridge right along the top of the skull. That's the sagittal suture. Finally, in the back, where the occipital bone is, lies the lambdoid suture. Facial bones. Nasal bone makes sense because it's going to form the bridge of the nose. But remember, most of your nose is cartilage. And that's why as we age, it seems like that darn nose just keeps getting bigger and bigger, because cartilage does not ossify. It doesn't become bony, so it just grows slowly. Something to look forward there. Maxilla is the upper jaw, and there's many large sinuses that empty into the nasal cavity. The lacrimal, these are right next to the maxilla. It's kind of hard to see here, But you find the nasal bone, which is the bridge of the nose, and then just inside near the orbit is that lacrimal. And this is where there's tear ducts for lubricating and protecting our eyes. The zygomatic arch I talked about is the cheekbone, and it's made of the maxilla in the front, but then it attaches in the back at the temporal bone. So it's that long arch of bone, which is really kind of two bones in a way. Continue with facial bones, the nasal concha, which you don't see in someone because there's membranes when they're alive. But these are extended into the nasal cavity, and so that when we take a breath, then air is swirled around, and it's really quite amazing. The air is swirled in such a way as that all the particles in that air are brought into contact with moist membranes, so that all that garbage that we inhale doesn't end up in our lungs. It also helps to warm and cool the air. So let's say it's cold outside, then that swirling action makes the air a little bit warmer. So you always want to breathe through your nose if you have an option. The mandible, think of jaw. It has a rounded condylar, which is in the back, and a coronoid process in the front. Together the two form the temporal mandibular joint, or TMJ. This may seem like trivia, but many people suffer from TMJ syndrome because they have inflammation due to grinding their teeth while they're sleeping or all sorts of other things. The palatine bones, if you look at the roof of the mouth, there's the soft palate, which is what you depress if you get hiccups, right? By drinking water upside down. But the palatine bones are the bony roof of the mouth, and the older you get, that suture starts to diminish. And so you can sometimes tell the age of a skull by looking at the palatine bones. All right. Paranasal, I'm not going to say much about these cavities. There's air-filled sacs. We call them sinuses, and they're named for their location. So I'm not going to test on this, but just understand that sinuses are breeding grounds for bacteria that become trapped, and that's why we got to keep that mucus. It's a mucus river. Imagine a mucus river flowing from the frontal down through the ethmoid, on through the sphenoid, the maxillary sinus, endless flowing river. And if you interrupt that river, such as you get a big mucus plug, the whole dry, crusty plug at the base of the frontal sinus, the river stops, and the cleansing actions stopped, and you're in trouble. You got to reestablish that flow. You can't always go running to your doctor, although if it's a problem, yes. But if you can reestablish that flow, breathing steam, there's lots of techniques, but keep that river of mucus flowing. Review here. So this is not additional material. Just want you to understand this is review because I just gave you a lot. Parietal, either side of the skull. Temporal, and there's a lambdoid suture that separates the parietal from the occipital. External auditory or acoustical meatus, where the ear is. Mastoid. Styloid, that's where the muscles of the neck and the tongue. I talked about the massage. The condyle and the coronoid process of the jaw. There's the zygomatic and maxilla in the front, mandible. Lacrimal, that's the tear duct associated there. It's in green. Ethmoid is where the cribriform plate, the perpendicular plate. The sphenoid bone is, you can see a little bit of the outside of it, but the better view is on the inside. Here's the posterior or back of the skull. Sagittal suture, I mentioned that one. Parietal bones on either side. Lambdoid, occipital. There's the occipital protuberance, that little bony ridge that you can feel with your fingers. Mastoid process. Continue with review, because I know this is a lot of information. Look at the front. You can see the nasal bone. The maxilla is in purple. And you can see a little bit of the sphenoid, one of the wings of the sphenoid. The temporal bone on either side of the skull. Ethmoid, you can't see much in this view. Zygomatic is that cheekbone. inferior nasal concha. That's the one that's going to swirl air around and either warm it or cool it, but certainly filter it some. Interior. A lot of these bones are starting to sound familiar, I hope. There's a coronal suture, upper right. Remember I mentioned that means crown. It's going to go kind of across the skull. The frontal bone, where there's some important sinuses, frontal sinus, for example. Now we can see the ethmoid, the crista galli. That's where the holes, when we sniff and smell something, the crista galli are involved with that. Sphenoid sinus, part of that river of mucus. There's many sinuses. Maxilla, mandible, palatine bones I talked about, the roof of the mouth. Sella turcica, that is the turkey saddle that's going to protect the pituitary. And the rest of it we've been hitting, so let's move on. A good view from an inferior aspect, maxilla with the palatine bones. I'm at the upper left. We're going to go counterclockwise. Zygomatic, temporal, styloid process, mastoid, that's one that can become infected. Parietal, there's that protuberance again. You see how it's just over and over, the same words? Here's a new one that I only hit once. That's the foramen ovale. That's a passageway through the bone. And the greater wings of the sphenoid. And yet another review, and that's okay. It doesn't hurt to hear these again. There's the crista galli again for smell. Ethmoid bone with the perpendicular plate that forms part of the septum. If you ever had a broken nose, then you might have injured the lower part of the ethmoid. Palatine bones, the roof of the mouth. Sella turcica again. Temporal bone. Continue with the exoskeleton. So we've been going through the skull. But we also have to cover the vertebral column and the thoracic cage, or the ribs. The vertebral column is different when you are very young because there's 33 separate bones. But later, around, was it age 2 or so? I'm trying to remember. At some point, those lower vertebrae are going to fuse and form the sacrum, which is 5 bones fused together, and the coccyx, which is 4 bones. The coccyx, I think it's named, Latin means cuckoo, so I guess it's supposed to look like a bird's beak. I don't know. Number of vertebrae. This is kind of important because when we're dealing with a patient, we want to know, is it C7 or C5? Is it T12? Is it L5, L4? So the vertebrae have numbers. The first 7 are the neck, cervical vertebra. Then we go down to the thoracic. There's 12 there, many of them attached to ribs. Lumbar, there's only 5 in the lower back, and they tend to be robust, big, heavy, plate-like vertebrae that carry a lot of our body weight. Sacrum, I mentioned, and the coccyx. Curvatures. The spine is curved, of course. In some cases, though, if it's concave posteriorly, that means from the back side, we call that lordosis. If the thoracic and sacral are convex posteriorly, then we have kyphosis. And then there's other types of curvature, such as scoliosis, and that's a lateral curvature from side to side. Here's a review of what I just covered. Kyphosis on the far left, lordosis, and scoliosis. Now, few of us have, well, I should say probably none of us have a perfectly curved spine. So let's not start worrying that we have one of these situations, because what we often find is in cadavers, people have lived till they're 80 and been very active. We look at their skeleton and we go, oh my gosh, this guy had all sorts of abnormalities. But we adjust. Our body is magnificent in that way. Okay, our curvature is developed by age 10, but some curves slowly change, especially as we get older. The curvature of, say, osteoporosis. Vertebra, all vertebrae have some similarities, such as the spinous process and transverse process. And these are important points for muscle attachment. So the spinous at the top, transverse kind of at the side. The body of the vertebra is the weight-bearing area. So in this case, you can see this vertebra example is not going to hold a lot of body weight. The vertebral foramen is a nice protective hole for the spinal cord because the spinal cord is so very fragile. And this is the one that if it's severed, sometimes we're looking at paralysis. So the body in its wisdom protects it with these really dense bony vertebra. Cervical, which is what we were just looking at, these are the smallest vertebra of the spine. The foramen tends to be triangular shaped, and there's holes in the transverse process, which for nerves and blood vessels. And most of these cervical vertebrae have a forked spinous process, except for the last one, number 7. And so you always know it's a cervical, at least C through 6, if you see that forked spinous process. Thoracic vertebra, which is T1 through T12, these have a long spinal process that tend to point downwards. And a lot of muscles, like the trapezius and some of the superficial muscles, attach to the thoracic vertebra. There's small facets where you expect the ribs to attach. And the body is kind of heart-shaped, fairly thick as well. Lumbar, these are the massive block-like bodies that have very short hatchet-shaped spinous process, because now we're at the lower back, and here, instead of having a lot of muscle attachment to the spinous process, there's the pelvic girdle, iliac crest. There's areas of the pelvis that are wonderful for muscle attachment. And so the main job of the lumbar here are to support body weight and provide mobility. Sacrum I mentioned. It's on the back wall of the pelvis, or the posterior. When originally it was 5 bones, but as we age it becomes 5 fused together. There's foramina. Foramina is just plural for foramen, holes, and these are important for the passage of vessels, blood vessels, and nerves. The sacrohiatus is important in medicine because that's the lower entrance to the spinal cord. And if we want to inject an anesthesia, such as think of during childbirth, if a woman wants an epidural, that is where the needle is inserted. It's an opening, one of the few openings where medicine could be introduced without trying to slip it between vertebral discs, for example. At the base is the coccyx, and we don't have complete fusion until about age 20 or 30. But in women, that coccyx still stays fairly curved, and you can always tell a woman's pelvis by the coccyx, by the way. It's going to be curved and flexible because think about this. If she's going to be delivering a baby, she needs some flexibility there. She doesn't want that bone to snap off. Men, we're not built for that sort of thing. Our coccyx tends to fuse and ossify pretty early in life. Remember, just a reminder here, because I know this is a ton of information. Exoskeleton, skull, vertebral column, thoracic cage. Let's look at this thoracic cage. The sternum is connected by cartilage to ribs 2 through 10. The inferior, which means the lower part of the sternum, is the xiphoid process. It's just a little point, and that's the one we have to be careful of when we are doing chest compressions. And I'll be honest, in a life-saving situation, it's fairly common for that xiphoid to be snapped because the healthcare worker is trying to do their best, but it's a stressful thing to give chest compressions. And people are screaming, and there's noise, and you're scared to death that they're going to die in you. Okay, ribs 1 through 7. attach to the sternum by what are called costal cartilages. And the ribs 8 through 10 attach to each other by cartilage. Okay, we want a lot of mobility, and that's what the cartilage is for. 11 through 12 are the floating ribs, or sometimes called false ribs, because they do not attach to the sternum. Now, they still have a job, of course. There's still intercostal muscles, and there's a lot of there's need for those. Okay, and by the way, women and men have the same number of ribs, just in case you're wondering. Ribs have heads with a facet, and that facet's going to articulate with the lower thoracic vertebra. This is important because we can't just have a rib that's like connected fully to a vertebra, because we need to have some movement, such as when we're taking a deep breath or we're twisting. There is a ligament that holds the tubercle of the rib to the vertebra, and as I mentioned, it provides movement and a good solid connection as well. If you've ever dislocated a rib, which is, I'll tell you, it's fairly common. You make a sudden movement and suddenly you have a pain sort of up your back, and it tends to be worse if you take a deep breath. And when this happens, often people think they've damaged something and they go to the chiropractor or they go to get a massage and they don't find much relief, because what happened is the rib just pops out just for like less than a second, and then there's inflammation. It lasts for several weeks, and there's just not much to do but rest it. It's kind of hard to ice that part of your body, but if you can, great. A more serious condition is a separated rib, and this is when the rib it comes out of a facet, and there's some trauma to the cartilage, and sometimes the pain resembles a heart attack. Okay, so this is you'll know when you separate a rib. Dislocated rib, sometimes you do it, you don't know it until that evening. You sit down and you go, wow, I have this little irritating pain right in the back. It's hard to describe. Okay, this one was pretty cool, but I know a lot of names, so go through it, and you'll see it's not as bad as it sounds on the first run through. All right, good luck.